Very good, very good.
Nice. Have you had a good week?
Oh, fantastic. Except for yesterday.
Except for yesterday. Why? What happened? Oh, that's not what happened. That's not what happened. That's not what happened.
Hey, Kwame.
Yeah, say it, and let us move on. Yeah, just say it.
So right now it's left with Man U to carry the glory of England. Kwame said also more Chelsea. Oh. Okay.
Yeah, Penama was a cutter. Man U.
And they say Akaye.
Oh, Jai.
This Thursday.
Chelsea is the hope of England. Yeah, understand? Chelsea is the hope of the world.
But Kwame, can we say Arsenal for Champions League, Man U for Europa, Chelsea for conference. Clean sweep. Now the answer,
but we can't trust Arsenal. So here we go.
The only time I decided to support them, halftime pen Mr. Tuko come fufu. So to all the Arsenal fans,
it go be, make you no fear.
Next week or how? Right, Kwame. So it's wonderful to be back in the studio.
Absolutely.
And we're going to continue our conversation, right?
Absolutely, yeah. We did start a conversation 2 weeks ago. We had a sequel last week, and now we get to wrap it up because a lot of people were looking forward to our conversation about the bulimia, part of the eating disorders. So this is probably the concluding part of our conversation.
The concluding part, absolutely.
On eating disorders.
Disorders.
Thanks a lot for coming by, Doc.
Right. So good evening to all our listeners, and Kwame, I want to say a special hello to Mr. Yaw Osafo of Tema, Yaw Osafo Enterprise. He's an ardent listener, loyal listener, very good friend of my dad, Kwesi Tete and son. Never heard, or quite some time since I heard from him. And yesterday he called and he was all over. He was like, he always listens to this, and I was like, Dr. Ben and I know how was Sana. Oh, Sana, me what fast.
Yeah, me what fast.
Right. So Mr. Yaw Osafo, I know you're doing the listening, and continue listening. And next week I'll definitely see you. So Kwame, we started this conversation about eating disorders, something that most people would not readily think of as a medical problem until it hits you, and then as a parent it can get very, very frustrating. We've also discussed the medical implications of the various eating disorders, and last week we took a deep dive and we started looking at anorexia nervosa. So this week we're going to continue the conversation, and hopefully time permitting we'll take a few calls as well. Today we're talking about the second angle, bulimia. And
Bulimia nervosa, you call it?
Yes.
That's a beautiful name, eh?
And so I know a day. Right, so what is bulimia nervosa? This is a type of eating disorder that's characterized by eating large amounts of food in a short time. When we say it, a lot of people are guilty, but there's more. But this is followed almost immediately by a type of behavior that compensates for the binge. All right? And what behavior are we talking about? Purging.
Okay.
All right? Purging. That is vomiting, excessive use of laxatives, or even diuretics, water pills. All right? So these are examples of purging techniques. So the person eats a large volume of food or large amounts of food in a very short time. And Kwame, as they do this, they actually have a sense of loss of control. It's like you are eating, you know you have to stop, but they cannot stop. But then at the back of their minds, they know that they're going to do something immediately they are done eating, which is that they are either going to purge, or they are going to undergo a prolonged period of fasting, or probably they are going to come to the gym and you ask them that, go, why? Because they undergo very vigorous exercise, because in their mind, what they have done, they need to undo.
Oh.
So commonly, they purge. They will induce vomiting by sticking their finger down their throat. So immediately they finish eating, or just at the table when everybody's, maybe having a chat and all of that. They excuse themselves, they go to the bathroom or go to the back of the house, stick their fingers down their throat, and then bring everything out. So then I'm sure a lot of people are listening right now and say, so what's their point? Well, the point is that he wanted to excite their taste buds. And they did that.
And that's all.
Yes. And then, Kwame, you remember that the first episode we talk about the satiety center, in the brain.
Yeah.
Where you get some satisfaction from eating.
And why don't you just chew the thing and throw it out? Why do you have to swallow it?
You are sitting at the table.
But the taste buds are in your mouth. So just...
But you can't be sitting at the table with us.
Then don't come and sit at the table.
No, but it's your wedding. They have to come.
Those people, they should let us know so we don't invite them.
Well, that is why it is a mental health disorder. I mean, we would laugh about it. It doesn't make a whole lot of sense. It's difficult to wrap your mind around it. That why is this person doing that? Why are you eating the food only to bring it out?
Yeah.
But I'm just letting you know that it is a matter of satisfaction, gaining some satisfaction from eating. So they excite their palates or their taste buds, but then they worry. Just as the patients with anorexia nervosa, they worry also about their physique. All right? And therefore, they want to bring everything out. So these individuals, they have this, what I've just described, is an alternating safe eating habits.
Okay.
Meaning they do the low calorie diets.
Okay.
With binge eating habits. So they will go a period, they are not eating, then Friday night or something, boom, and then they go on this, the way people go and splash the cash, go and burn the cash, they also just eat in this manner as if, there's no tomorrow. They can eat an elephant if you give them the time. So they have this alternating safe eating habits with their binge eating habits. So that is what they generally do. And binge eating is what we have just described. You eat a whole lot of food without control over a short period of time. The behavior is usually secretive. That's another point that I wanted to make. So you don't really find them. And when we put out a flyer for this, someone sent me a message.
Right.
And I know he's a mental health practitioner, or he was a mental health practitioner in the UK for a long time. And he was sharing with me. I think I might share that
You
message
want me to read it?
with you. Okay, all right.
Your topic today: bulimia and binge eating, white woman's disease. In all my years in mental health, I rarely came into contact with African or Caribbean patients with bulimia, binge eating, or anorexia. A lot can afford to waste food. Seriously, they are quite difficult problems to deal with. In its worst cases, it shows the depth that bulimic patients can sink just to satisfy their bulimic needs.
Right.
Years ago, I came across one of my inpatients eating from the food waste bin at night.
Yep.
Terrible sight, and never forgotten it.
Yeah. So this is a very, very experienced mental health, professional. And so this person was on the inpatient unit. They will crawl when everybody's sleeping quietly to the food waste. And out there they segregate waste.
Yeah.
So they've got bins for food.
Yeah.
And then general waste and so on and so forth. So we found this person doing that. So binge behavior is usually secretive and associated with feelings of shame or embarrassment. All right. And they are always concerned about their weight or their shape, and also it affects their self-worth. But unlike the anorexic patients who look like half of me, the bulimic patients, they could have a normal weight.
Okay.
Yes, they could have a normal weight because they do this alternating thing. They would eat sometimes. So sometimes they go under the radar. Right. So how can you identify what should make you suspicious as a parent or a guardian? Well, the first thing is that if you find somebody making frequent trips to the bathroom right after meals, or excusing themselves right after meals, I mean, it could be that once a while we eat and then
Runs to.
You need to go. But Kwame, what every day you need to go? No, that should be a red flag, or that should raise some suspicion. Number 2, large amounts of food disappearing or unexplained empty wrappers and food containers. That one, typically, if you have a lot of teenagers, boys in the house, that one too, large amounts of food can disappear. I don't know. But Kwame, remember I mentioned that the behavior is secretive. So the person hides to eat because they're embarrassed by it. Say, but we bought 10 balls of kinky. Yes, we saw you eat 2. And they say, eat. I don't know for. What happened? The person has gone to consume the rest. If the teenager keeps reporting sore throat all the time, so chronic sore throat, again, should raise some suspicion. Why? If you are sticking fingers and other objects down your throat to induce vomiting, the risk of introducing infection in the mouth and in the throat area is very high. 4, dental decay resulting from erosion of the outer covering of the tooth, the enamel, is also something that points us in that direction. There's acid in our stomachs. So anytime you stick your finger down or you induce vomiting, you bring the acid up. The acid would bathe the teeth and erode the enamel. Yes. Because acid tends to, erode things. So if you are doing that all the time, of course, once in a while, I don't even remember the last time I vomited, from illness, anything of the sort. But these guys are doing this in like once a week or twice a week, so it is too frequent. They tend to develop heartburns and then something we call GERD, gastroesophageal reflux. So they will tell you always that the central part of their chest, there's a burning sensation or that area tends to hurt. They tend to always have laxatives with them. These are OTCs, over-the-counter medications. So they tend to always have that. So if you search your teenager's room or something and you find it, or you find it in their bags or something of that sort, it should be an alert. Recurrent unexplained diarrhea. Because one of the purging techniques is also what? The use of laxatives. They want to induce diarrhea, to bring out all of the food they ate before it is absorbed. And then also feeling dizzy or fainting, having fainting spells. So because of all this diarrhea that they induce, the vomiting, there's a tendency for them to become dehydrated and then have this feeling of lightheadedness every now and then. So these are all telltale signs, or these are all symptoms that should get a guardian or a parent worried enough to want to talk to your family physician.
How bad is it? How bad can it get?
Well, it can get really, really bad. Bulimia can lead to rare but potentially fatal complications. You can have tears in the esophagus, that tube-like structure that connects the back of your mouth to your stomach. All right? When you retch, when you induce vomiting, create so much pressure in there and also bring all of the acid up. The acid tends to burn and erode the lining of the esophagus, and that may cause you to have bleeding episodes and also generate tears in that part of your anatomy, and that can be very, very dangerous. Of course, the dehydration and subsequent electrolyte imbalances are also not very healthy. Diarrhea can lead you to develop hypokalemia, low levels of potassium salt. And potassium is very, very important for cardiac function and also skeletal muscle function. I will put the treatment of bulimia nervosa together with the binge eating disorder, which we shorten as BED, binge eating disorder. So Kwame, that's the last angle that I want us to discuss. So, as with bulimia nervosa, people with binge eating disorders have episodes of binge eating, meaning they are eating large amounts of food in a short period of time, usually with a sense of loss of control. But they are distressed by the binge behavior. Unlike the people with bulimia nervosa, however, they do not regularly use compensatory behaviors to get rid of the food. So that's the difference between the binge eating disorder and the bulimia. They're both binge eating, but one adopts a behavior immediately after the binging to purge, or undergo a long period of fast. So like 3 days, he's not eating because of the binge eating, or they would also undergo very vigorous exercise. But for binge eating disorder, they do not regularly use compensatory behaviors to get rid of their food. But binge eating disorder can also lead to serious health complications. Obesity is one of them, because they are keeping everything. So they are eating high calorie diets, large volumes of it, and they're keeping everything. And although they know they are full, they just can't stop eating. Let me share with you some of the features that we see. And for us to make the diagnosis, before I get into that, these frequent binges must happen at least once a week for 3 months.
Okay.
Yes, once a week for 3 months before we clinch the diagnosis. And every time, the person must have a sense of lack of control. That I want to stop, but I can't seem to stop.
Yeah.
All right. Now, these are some of the features. You are eating more rapidly than normal. So, can you remember Rablo? The Last Supper.
That one, it was a survival skill. It was a survival skill.
So you learn to eat very fast, because you're eating in a group, and then so that's a present thing that we did. But let's just say, Kwame, here you are, you are the only one eating for this big bowl of food. I think generally we'll all take our time, to consume food.
Yeah.
But if you observe that your child is eating so that you think like, hey, only one take your time. So eating more rapidly than normal, eating until uncomfortably full, eating large amounts of food when not feeling hungry. That one, I think Philip is a little guilty.
And not a little.
No, not a little. Okay, so that one, Philip is guilty. Eating large amounts of food when not feeling hungry. Because Philip, he doesn't say, if you give him food, he always eats plenty. Anytime he comes to my house, you give him the food. There's nothing like, or coming to the house, or coming to you. Never do that. Okay, tell me house or coming to. Right. Eating alone because of feeling embarrassed by how much one is eating. So Kwame, it's a serious problem. They recognize that there's a problem. So they're not comfortable eating with people, because Ubia Beshen and say, hey, Charlie, why are you eating so much? And females are usually a bit more aware of how they are perceived rather than the guys, because of the sociocultural environment. If a man is eating a lot of food, I don't think a lot of people complain, but a female eats 3 balls of kinky, and then I don't know, everybody has a very different take on that.
I know somebody who can eat 3 balls of kinky, a lady who can. Yeah. I think I need to bring her to your hospital.
Okay, Father Bra. Father Bra.
Ohiamwa.
Right. Feeling disgusted with oneself, depressed, or very guilty after a binge. So if anybody is listening, if you're listening and you feel guilty about your eating habits, and you think that, yes, you are eating, even when you are full, you cannot stop until you're so uncomfortable because you're too full.
Yeah.
So that will point us to binge eating disorder. So Kwame, in the last 3 weeks, we've spoken about anorexia nervosa, bulimia nervosa, and binge eating disorders. These are mental health disorders. and always the best treatment or the most effective treatment for most of them is what we call cognitive behavioral psychotherapy. You know, either individual or group-based psychotherapy. You know, where we try and change the behavior of the individual through some counseling sessions.
Okay. Well, if you have any question, you might want to send us a WhatsApp message on 055 or call us on 0302216541. I think we have some time to pick up a call if you have any question or you need clarity on anything. But this has been very, very informative. Honestly, I didn't think that eating and not eating could get to medically unsafe levels. You know what I mean? Yeah.
You know, so particularly anorexia, where people are just fearful of food, very mindful of what they would eat and how much they would eat, because they're very concerned about their body size and body shape and all of that. So it is not something that it's usual. You may think that, in our part of the world, there's hunger, you know, so if food is not a problem. But probably there are also communities where people or societies where really food is available, you know, and you have to pay particular attention to that. And the teenage group, probably there are always issues. So I want parents and guardians to pay particular attention to all of these situations.
Okay, so Nana in Sakomonos question, quite generic, but let me just read it. Doctor, good afternoon. What causes vomiting after eating? I just don't know what is wrong with me. Food just can't stay in my stomach. Please help me.
Right. So, Nana's question, I presuppose is that she's not inducing the vomiting.
I don't think so.
All right. So it wouldn't probably fall under what we're discussing right now. And there might be a number of different reasons why people vomit, but commonly, a lot of people will have something we call dyspepsia, gastritis, peptic ulcer, right? These are all related medical conditions where the lining of the stomach is being eroded, and you may have a frank ulcer there. And anytime food gets in there, it feels like it has to come out for you to get some relief. You know, beyond that, there are other things. The stomach is a pouch. It's a holding bay for food. The extreme form of it would be that if you have some cancer that is occupying a significant part of the stomach, then you have reduced the volume of that stomach, and therefore anything that goes into it or the standard meals that you take tends to come out. So I'd say that it's a long list of possibilities, and she should seek medical attention so that there'll be a lot of Q&As, examination, and probably one of the things we have at our end is the endoscopy center, where we stick a fiber optic cable down your throat and then we look.
Okay.
You know, so there are quite a number of options.
Patrick sends a message and says, Doctor,
yes,
I've been eating 3 balls. I'm sure of kinky. That's what he.
Right.
I'm sure he didn't add it here. He says, right. I've been eating 3 balls since age 25 till now. I'm 42, and still feel normal. I am rather strong.
Right.
Should I stop?
Kwame, the size of the balls have changed. Do you know that? Unless we reset to the 25, when it was 25 years, we have to measure. We have to measure. Right. So, well, I mean, nothing wrong with the 3 balls. Not as if we are saying that 3 balls of cake, anything wrong with it. It depends on your energy expenditure. You're a footballer, you go to the gym, and all of that. You know, you can eat a certain amount. But if he's eating 3 balls of kinky and he doesn't feel uncomfortably full, I think it's fine.
You know what I think? I mean, the fact that Patrick has asked the question about it, subconsciously he thinks that there is 3 is too much.
3 is too much. Yes. So yes. Well, if he's starting to think
Patrick,
that
3 balls of kinky in one city.
Quite I eat only 1 ball.
The other time.
I
saw Anita eating some nice fanti kinky.
Okay.
And the fanti kinky, it's not even big.
Yes, at all.
So I couldn't eat half.
Wow.
Okay,
Yeah.
well, the fish was nice.
Nice. Okay.
Yeah, so
Okay.
I just kept eating
Eating
the
the
fish.
fish. Yeah.
I was like,
I
what's
think
wrong
you've
with
trained
me?
yourself. I think when you train, or you realize that you don't really need a lot
Too
of food.
much,
Too
yeah.
much. Yes.
But
So-
why is it that some people like Philip Denti, they eat like plenty and still are
look at the body.
You see this?
As a Philippine time working with, I
Did
feel
they
very
call him?
comfortable.
Does the food sublimate?
Wow, one of my uncles said, time for people like me, our stomach is at our back. Oh, dear. Yes.
Anyway,
Yeah,
for those who want to get in touch with you, I'm sure some people would like to get in touch with you. How do they do that?
Right. So for those who want to get in touch, you can come by physically, number 10 Kincho Street. Come by our East Legon Hills branch around the Ashalibuche School Junction area. If you want to reach us on WhatsApp, the number is 0501 477 340. You also want to call us at 0501 477 340. We'll always continue the conversation on our social media handles at MedicalsGH for X and Instagram.
All right, Doc. Thank you so much. This has been very, very informative, and it's been 3 weeks of good education, and we're grateful that you shared with us. Yeah.
My pleasure.
Dr. Yaw Osafo is the CEO of Medicas Hospital. You have his details as well and his contact. You can reach out to him and his team on any health issue, and they'll definitely take care of you as well. Yeah, they're great at it. No doubt about it. Well, stay tuned in. There's more here on Joy FM.
Well, quite rightly.